and welcome to a new tutorial. In today's video, we would like to show you defibrillation and cardioversion using the shock paddles. To do so, we've brought along a corpuls3 and a corpuls3 touch. Here you can see the defibrillation model with the shock paddles. And, in the foreground, the adapters for the shock paddles for our smallest patients up to 5 kilograms.
Before the actual function check, a visual inspection of the shock paddles needs to be done. To remove them from the defibrillation module, gently twist them forward and back, and then they can be removed sideways. Now we can check the cables and the shock paddles themselves for external damage or significant contamination. The contact surfaces should be scratch-free. The same goes for the adapters for the shock paddles. Lastly, we check that there is enough defibrillation electrode gel.
After the visual inspection, we'll move on to the actual function test. To do this, we have turned on the device. First, we want to check the 2 shock paddle buttons. When pressed alternately, you should hear a confirmation tone. Andy, can I get you to start manual mode and select async as the synchronization mode?
Okay, I'm starting in manual mode.
Rhythmuskontrolle durchführen.
Going to async.
We have the option to select the energy setting traditionally on the device. With the shock paddles, we now also have the option to select it by pressing the shock paddle buttons. Using green, we can reduce the energy, and using red, we can increase it again. Once we are done, we place them back in the holder. To test the shock delivery, we have pre-selected 200 joules. To start the charging process, we have 2 options, either on the device or via one of the 2 shock paddle buttons. When the defibrillator is fully charged, we can deliver the shock by holding down both shock paddle buttons.
To test the shock paddles in connection with the corpuls3 touch and the slim defibrillation module, they must be connected to the therapy master cable. With the device turned on, I now hear a confirmation tone when operating the shock paddle buttons. The actual shock delivery is carried out here in a test box. To do a function check of the adapters for the shock paddles, which is necessary before every use on the patient, they need to be connected to the shock paddles. This is done on both by positioning them and locking them into place. Once the adapters for the shock paddles are connected, the set energy automatically reduces to 1/10. For the test, we've selected 10 joules. Ultimately, defibrillation is effectively performed with 1 joule. During the function test itself, the 2 lights briefly light up when the electrodes are held together during the shock delivery. The LEDs briefly light up during the shock delivery. Additionally, we can see on the monitor that a shock has been successfully delivered. We also need to mention that selecting the energy via the shock paddles is not possible with the adapters for the shock paddles attached.
To demonstrate defibrillation and cardioversion with the shock paddles, we have set up an obvious training scenario here. The patient has been prepared. We have attached a monitoring ECG, unclothed the upper body, and if necessary, shaved and dried the chest. In our scenario, we want to administer an unsynchronized shock to the patient in obvious ventricular fibrillation with 200 joules. First, we apply gel to the contact surfaces of the shock paddles to create better skin contact. Next, the shock paddles are positioned, the defibrillator is charged, and the 200 joule shock is administered.
And charging. Attention, everyone move away from the patient. Shock. Attention, everyone clear. Shock in 3, 2, 1.
In addition to asynchronous defibrillation, you also have the option to use the shock paddles for cardioversion. Here, you must make sure that the shock delivery is synchronized.
For the use of the shock paddles in AED mode, it is essential that a monitoring ECG is applied. The rest of the procedure is similar to manual defibrillation. Gel is applied to the contact surfaces. By pressing the button, the analysis can now be started.
Do not touch patient. Analyzing heart rhythm. Deliver shock.
Attention, everyone move away from the patient. Shock in 3, 2, 1.
Perform CPR.
To deliver a shock, the impedance must neither be too low nor too high. If the impedance is too high, we should make sure to use enough electrogel, clean the chest, and if necessary, shave if the patient has excessive hair growth.
Reasons for impedance being too low could be a wet skin surface, for example. This must be dried thoroughly. Using too much gel can also become critical, especially when gel bridges form between the two electrodes. We hope we could provide you with helpful tips and tricks in this video. It would be great if you could subscribe to the channel, leave us a comment or a like. We'll sign off and say goodbye.
Ciao.